Massive thank you as always to patrons Sarah Turner, Rebecca Johns and Justin Harper. And this week's random call out goes to patron Callista Salazar. You can support us too at patreon.com/It's Not Just In Your Head, or follow us on social media and help spread the word. For those new to the show, my name is Liam and I edit and produce the podcast, as well as do some backseat co-hosting. For regular listeners, co-host Max Golding has recently posted on our Patreon Discord because he's leaving the show, sadly, due to lots of life commitments. His post is worth a read. Hopefully he'll pop back now and again. However, before he left, we all spent some time trying to find a replacement co-host, and today New York-based psychotherapist Harriet Fraud chats with our new co-host, Ikoi Hiro, a substance use disorder counsellor. And what follows is a wide-ranging discussion. As for the rest of the month, we have various guests lined up. Susan Rosenthal to discuss capitalism and mental health, Catherine Liu to discuss how trauma is used by the professional managerial class, and author John Bales, extending our conversation from last month with Dr. Alfie Bown about video games and desire. We're going to be discussing how certain video games naturalize neoliberal ideology. It should be an exciting month.
In the mental health field, too often, we've made it seem as if it's just in your head. Just in your head.
The landlord can hijack the rent by 20%. That impacts people's mental health.
We can't have a profit-driven mental health care system if we want our people to be connected and healthy.
I was wondering, what kind of vision do you have for It's Not Just in Your Head? What kind of speakers do you want? Why did you join it? What do you think? What do you want to do with this?
Well, yeah, mental health is such an expansive field. It's a developing field in many ways, and one aspect, I guess, of the more, I would say, troubling trend in mental health, right, is, on one hand, it makes sense to, the whole DSM thing with, how it used to be the Greek numerals and now it's the Arabic. That's to, match the medical side, right? And so it's kind of on one hand, mental health, and at least the brain is part of the body. So that merging with the medical infrastructure is not necessarily a bad thing. There is an important component to it. But one of the aspects that it's going is it's becoming almost too strictly biochemical, right? With very little regard kind of taken to how people's behaviors develop over time, and to a certain degree, nothing against mental health medication because they are lifesavers and vital for people.
Sometimes they are.
Yeah. But at the same time, there is a tendency to, I think the focus on the biochemical has to do more with expedience than actually a regarding patients holistically.
Yeah. Also, I think there is a political component to try to make it your biology rather than the social forces that are warping you and making it hard to live.
Right.
The political economy aspect is excised from the equation.
Absolutely.
With biochemical, which is another thing I think we all want to challenge.
Right. And that's part of the whole kind of the title, right? That it's not just in your head, that it's not just a chemical thing, but, it's many things coming together. That's, being able to talk about the social, the political, the environmental, all these different contexts in mental health is really, really important. So I guess that's one of the aspects of it. And another is just that, it's a field where, on one hand, people say science adapts to incoming information, but it actually doesn't really, and it's kind of, it's a area where, the incoming information and the adaptation is kind of a huge conflict.
It's interesting that the National Institutes of Mental Health have said that the DSM is limited and too limited because it doesn't take into consideration the etiology, the origin of the problem, but they don't have the advertising budget of psychopharma. So that message is lost.
Right.
And we need to bring it back.
A month or so ago, when Max Herriott and I initially spoke to you, was just that you had a sort of different experience as well, like what you're doing now, what your background is. I don't know if you wanted to sort of talk about, how you work at the minute and what your sort of day to day is.
Well, yeah, I mean, right. I actually ended up leaving the facility because there are COVID employee protections, as you might guess, was terrible. And we ended up losing staff. Staff ended up dying because of it.
Whoa.
Yeah. Yeah, well, it's one of those things where like the death of the staff was kind of like, we don't know if he died of that. We don't have confirmation,
Yeah, well, just in case he died of that, it would be worth not taking the chance of dying.
I was like, okay, like you guys literally do not pay me enough to
die. Right.
Yeah.
Yeah, well, it does seem like the kind of corporate decision-making that's being pushed in the United States now. The workers should go back after 5 days, especially health workers, because they want more. Too bad for you if you're going to die. That there is a push. We have to make money. We have to keep operating. You're going to be sacrificed.
Absolutely. Yeah. Well, I mean, the care sector has always worked on an efficiency model, not a redundancy model. And what the care sector always needs is a redundancy model, right?
What do you mean by that?
In terms of staffing, we should always have more, should have a lot more staff than we think we need.
Mm-hmm.
We understand backing up data.
Right.
But we don't seem to, want to back up staff, right?
That's very important. That's what those 60,000 nurses were on strike against.
Right.
That they needed more nurses in order to give reasonable care.
Yeah, proper care, and I mean, social services have always worked on shoestrings in terms of budget and staffing,
Right.
So yeah, on one hand, I understand that the extreme understaffing means you often can't enforce things, but at the same time, it just got to the point where
it's too dangerous. Yeah. At this point, it's too dangerous. I think that's why those 60,000 nurses went on strike in Boston and against Kaiser in California, because to ask people to work that hard and then expose them to COVID when they're already exhausted and their immune systems are down from coping is a high price to pay.
Yeah.
In the U.S. now, 1 out of 5 healthcare workers has quit.
Yeah, or gone into different sectors. At least they're not in emergency care.
Right.
Right. Emergency and hospital care. That's where they're really shedding, the staff.
It's sort of interesting because in the UK, obviously, there's a slightly different circumstance because of the NHS, right? However, they have been sort of consistently underfunded for the last 10 years and overrun and overworked. And then this past couple of years has obviously been intense and horrible. And now it just seems like the government's take on this whole thing is just hands off, complete apathy. And the hospitals are just sort of overrun. And in one particular part of the country, they've said, you just have to make your own way to hospital because, there's not enough ambulances. And so everything's just sort of got really chaotic here. And I think, I guess it's maybe easy to guess why, right? Which is that just they want, the NHS stands as something sort of socialist ultimately that is not compatible with sort of neoliberal politics or ideology, and they just want to run it into the ground so that everyone jumps ship to private practice or whatever.
Right.
Yeah.
I mean, that's a very, I think Noam Chomsky, It often talks about how like underfunding public services is like the first step to privatization, right?
Yes.
And that's been like an obvious thing that's happening with the NHS. Not just the NHS, in a lot of countries with socialized medicine is seeing a lot of privatization creep in.
Yeah, although the United States now leads the whole world in death of COVID because it's entirely market driven. So it's the counterweight example.
Oh, yeah.
It's more than 800,000 who have died. Whereas in countries where the government is very involved, even if it's authoritarian, in China, where it started, about 5,000 people have died.
Right.
And in New Zealand, 51 people have died. I mean, it's shocking, the discrepancy.
It depends on your definition of authoritarian, right? Because on one hand,
Right.
obviously China has not a great track record of sort of human
Civil rights.
Yeah, and all that sort of stuff. Right. However, you could say like it's some sort of screwed up authoritarianism that just means that everyone has to die for capital.
Exactly.
Right.
They keep their people safe in this city of Xi'an, which has 13 million people. They close the borders. They don't care if they're making money in Xi'an. They're closing it down because I think had a few cases.
I think they're also, I'm not sure if this is, they're also facing another outbreak there. I guess it's the
all over
hantavirus.
The world. Yeah, well, all over the world, because there is no supply of vaccines and boosters for the entire world. World travel means world spread. And
oh, yeah. No, I mean, like there's another virus that they're also dealing with in the region.
Right. However, on the other hand, they stockpile virus, whereas in the United States, they don't, because they're making money, and you don't get money for the stockpile until it turns over. So they wait until people are very sick and then start producing, which is why we don't have sufficient tests, even in New York City. It's crazy.
Well, I mean, they Abbott destroyed like over was it 10 million tests or something back in the summer because they overproduced. Again, like this efficiency model and not a redundancy model. Like it's not this idea of, oh, let's keep it around because we might need it later. It's destroy stocks now so that
keep
we can
up the
prices. Right.
Exactly. So that these tests, first of all, 2 scientists invented a test which they did not patent and they want available to the whole world, which is wildly cheaper. But because nobody was making money off it in the United States, we didn't subscribe. It's all over Africa. But, then there's also the fact that the tests, which are supposed to be regulated by the government and no more than $5 for 2 tests, are now selling for $35. Right. Because the people can make more profit down the line. So that profit really, one of the things that I think we have to emphasize is how much profit interferes with mental health and any other medical care.
Oh, absolutely. Absolutely. I mean, I think to a degree, like drug rehab is one of the rare exceptions. And I say rare exceptions in that like paying more doesn't necessarily get you good care.
Right.
You get like spa services, but that's not necessarily
right.
So it's kind of, you get your like custom, catered menu and your meals are cooked by a chef. But, does that necessarily translate to like getting care for your problems? No.
Exactly. Ever since they allowed rehab to be covered by affordable care, all of these totally unqualified people have sprung up, claiming that they are addiction specialists and creating what you call spa care. I mean, it's perverse.
Or just, one of the major issues is like sober living facilities and how they really exploit
Right.
people, and people leaving, right? And the profit motive does kind of incentivize a lot of places to focus more on customer service than providing care. Because
Yes.
returning customers are also very profitable.
Yes, that's right. And by not treating the addiction, you can be sure they come back.
I'll say in the intro bit, the job that you do or were doing in particular, it was to do with people with drug addiction, right? And that place was to do with homeless people, correct?
Right. Right. We were a LGBT Medicaid funded facility that worked with majority housing insecure and homeless LGBT populations.
Right.
Yes.
Right. So we can dig into that, but just as a sort of side, you were just talking about a sober something or other. I'm not
Sober living.
Can you explain what that is or
Okay, so a lot of times when you leave rehab, right? What they do, what's often recommended is it's kind of like a halfway house, right? Where you pay rent and you live there and you're drug tested there, and so it's kind of like a step. It's supposed to be like a step from going from like a completely controlled environment to a less controlled environment before you're like set free to society, right? So to help you, like the concept in itself isn't necessarily bad. It's to help people maintain sobriety once they leave a facility, right? That they get some services, after leaving a facility. But one of the major issues is one, like, of course, there's it's expensive. There's a huge lack of number of these housings available. A lot of sometimes like courts will require it. Yeah, and it's one of those things where like how it ends up functioning oftentimes is that one, like, it's not necessarily like these places are again often run for profit.
Yes.
And so when you're talking about like people still in a fairly delicate place in their life, right? Stuffing bunch of them together in a house, very oftentimes very unmanaged, where like there's nobody to really deal with like the interpersonal conflicts that come up, because usually it's you don't get your own room, you share rooms, right?
Right. Okay, that's intense.
Right, which is always kind of like as an adult especially, right?
Yes.
It's kind of like stoking conflict right there.
Yes.
Very rarely are halfway sober livings managed well.
Yes.
In a way that like ideally you would think of good management, right? Of like there being like people always available to like talk to and have your concerns discussed. Is it sanitary? Is it safe? Are they really maintaining a certain level of safety, which includes like actively managing conflicts between residents? But because it's run for profit, it's kind of just like a mill of money.
Yes.
For a lot of these, profit run sober living places.
It also seems to me that it's an invitation to abuse, because in those cases where they have it over you, that if they report that you're not cooperative, you go to jail.
Right. You go to jail, or just even like, just even a lot of people don't necessarily have another place they can go.
Right. And so one can threaten them and coerce them in ways that are sick.
There was a big article about it. If I find it again, I'll send it to you guys on email. But like sexual abuse is rampant, right, in this industry. Yeah, I mean it's kind of like I remember talking to a friend of mine, and because I post a lot about like the drug rehab industry on my Facebook, and one of my Facebook friends who was just like, oh yeah, like I never wanted to talk about this because normal people wouldn't believe me. I can't tell you the number of times my mom was in rehab where she was propositioned sexually by her counselors.
I'm not surprised. And also, since they don't institute peer review at these places, there is no accountability. And I think wherever you don't have checks and accountability, you're going to have abuse.
Yeah.
And there is none here.
And I think what also one of the major issues with kind of like, 12 steps and how they kind of merge with like counseling is like a lot of counselors have experience as a sponsor in 12 steps, and the role of sponsoring somebody and a role of counseling somebody is a very, very different role. It's an incredibly different role. And a lot of times they get that confused, so they treat their counseling like they would as if they were a sponsor.
Can you elaborate on that, the difference?
Well, like sponsorship is very much more of a personal, intimate connection, right?
A friend, right?
Yeah, it is much more of a friend rather than like there is a certain professional relationship aspect to, your therapist, your counselor, right? Your caseworker, your case manager. That, is very like, your sponsor is somebody that you can technically call at 2 a.m.
Yes.
Right? Your therapist, you can't do that. Your counselor, you can't, and so it's one of those things where like there are certain professional divides that are really important to adhere to in this field.
Mm-hmm.
And I think a lot of times, when they come from the sponsoring sector, it can be harder to make those kinds of
boundaries, really.
Yeah. And it's also just one of those things where, like, to a certain degree, a lot of times people kind of function on this is what worked for me, so this is what works on everybody.
Yeah.
And that's not necessarily true. Yeah.
Right. It really is important to get your perspective because you are in a particularly fraught situation there. 100,000 Americans died of overdoses from 2020 to 2021.
Yeah.
So that
we hit a record.
Just like we did with COVID deaths. The United States is a world leader in many aspects.
Right.
But it's hugely important and hugely neglected in terms of oversight, in terms of funding, in terms of accountability.
Mm-hmm.
Why do you think it's so neglected?
It's a stigmatized population. Stigmatized populations are stigmatized fundamentally. I mean, what does stigma mean, right? Like, what's the end result of stigma? It means that your concerns are invalid to society.
What population are you talking about, just to be clear what you mean?
To a certain degree, yeah. Like if you are a drug addict, as a population would label you, right? You are kind of put into the moral reprobate category.
Right.
Yeah.
And so punishment is appropriate and help is not.
And that's where like the tricky thing comes in of like, so much help and the language of help is, infused in the industry, but it hasn't really gotten over the fact of like, what does it mean to deal with a stigmatized population? How do we go about discussing the stigma, removing the stigma, creating public understanding? There's been so many fumbles in that. And there's also, a lot of like moral fear and panic around drugs that's decades old.
Yes.
So it's an easily scapegoated population.
I wonder, are the majority of the drug addicts that you see or that you know about from previously stigmatized populations? Because you see LGBT people who are stigmatized to begin with by the society, but I wonder if people tend towards addiction who are already socially stigmatized even before they become addicts.
Drug use and compulsive drug use or harmful drug using behavior is available in every sector of society. Right. There is no sector of society that is where it doesn't impact people. But you do see a much larger population in those that have, obviously experienced, child abuse, poverty, mental illness, right? Mental health conditions. Yeah. I mean, so LGBT minorities, right? Sex workers, you do see a fairly, those sectors do see a lot more.
Because in that
absolutely.
Book, in the book Deaths of Despair by Case and Deaton, they say that most addicts now are between 44 and 55-year-old men who expected that they'd have some seniority and dignity and don't, because the United States has smashed the working class. But I don't know if that's statistically true now.
Well, I think to a certain degree, I think that's the highest number of suicides.
Yeah.
If I'm correct, right?
It is males of that category.
Yeah. And men
White
tend
ones
to succeed in suicide a lot more because they tend to take a lot more definitive.
With guns, they tend to use guns.
Right. Women tend to, use other methods which have, a much lower success rate versus men tend to use much more definitive methods. Oh, absolutely. White men, right, is not necessarily surprising.
No, it isn't. And it has a huge class component, which is always denied or too often denied.
Yeah, there's a huge class component. There's also, and to a certain degree, I think the class component also comes around to, social connection component.
Yes.
Right? And there's also a gender component in that with men.
Yeah.
Because even with, I guess, gay men are a little bit different. Older gay men, tend to have a lot of survivor's guilt. And also just lacking a lot of, and lacking a lot of their peers. Their peers died off, so they have much less people their own age to, bond with and whatnot. So, the gay male population is a little bit different than the straight men, but we did have a lot of, we also did have, the heterosexual people come through.
Yeah.
And it is really interesting how well, and even just, one of the major things about, and I guess that comes into the family component of our society is, how many people don't have really their only close relationship is their romantic relationship. And this is true especially in men, and a lot of times, a lot of men, when they get divorced, they end up losing their entire social circle.
Right, because women do the job of socially and emotionally connecting men as a rule. And so when they get divorced, women still bond with their friends, they bond with their children, they bond with their relatives, and men are isolated.
Kind of, adrift.
Yes.
Right. So divorce and how socialization and family is kind of structured in capitalism does definitely end up in some ways. I think it does. That's one area where I think being, a man has definite disadvantages.
Huge emotional and social disadvantages.
Yes, absolutely. Yeah, just, as a woman, I can have a level of like physical affection with my women friends that like, most men find kind of impossible.
That's right, because it's branded here.
Right.
It's branded as gay.
I was at some comedy club in LA and they were just like, yeah, I can't remember what the joke was. It's something about like, I can't figure out if you're gay or British, gay or European, Because
Oh, yeah.
it's that whole idea of like, to be a man in American culture, I think is a lot more enforced than it is in Europe generally. And Europeans, like French, German, Spanish, in comparison to British men, are also very different as well.
Yes, and Italians, that it's okay to hold hands. It's okay to put your arm around each other. It's okay to be tender with one another without being labeled as homosexual, which in the United States is still a term of opprobrium, sadly. No, men are in worse trouble, and they're all the mass killers in the United States are men. There haven't been any women who do mass shootings. And they're all men who have either been who've lost a relationship or lost a job or both.
Yeah. Well, I mean, because to a certain degree, that is your entire identity.
That's right. As a man
is like, your worth is, the fact that like you have a woman and a job. Right.
That's right.
Yeah.
And even the gay guy who killed 49 people in Orlando, Florida, in the nightclub, he had just had a terrible relationship jolt as well and decided to get revenge by killing the gay people in the gay nightclub. That's much more of a male idea to recoup yourself through violence against others, with the allowable emotion being anger, which is not an unmanly emotion for Americans.
Right.
Whereas tenderness is, unless it's in a sexual context.
Right. But even then, it's kind of, I think I grew up as a tomboy, and, the early part of my life, I had girlfriends, but like most of my friends were boys. And I think it was right around, and funny thing, like as a little kid, I used to identify as a boy, and my grandparents were like, you're a kid, you can be whatever you want, we don't care. So that was kind of their attitude towards like, whatever. They're like, you want to be a motorcycle racer, that's fine. You
go, girl.
Yeah. Like, you're short, you're not going to do 750 with that height unless you eat, right? So that was kind of like their attitude towards gender. And I cut my hair short. My mom was like, whatever, you do you. But right around 10 to 12 was when I realized being a boy really sucked. Where like I started to get like this really strong impression of how much being a boy sucked, in my opinion, is like, a girl that had mostly boyfriends, but also had like, close relationships with other girls to see the other side, right?
Right. And so would you specify the ways that being a boy sucked?
I realized, one, that like as a girl, I could be feminine, right? Wasn't a problem if I wanted to be, and as much as,
girls have a choice.
Right. As much as like, a lot of my interests, like things in sci-fi and whatnot, lean boys, I also like theater. I also liked costumes and film and dancing. And so like, and as a girl, my access to those things weren't socially impeded. Right. That I could access boy things, I could access girl things. Versus like my guy friends, because some of my guy friends were very effeminate, and the amount of harassment the amount of harassment, like, I used to like have this whole hand signal thing with one of my classmates because he would get his ass kicked in the boys' room, like consistently, right? And so like we had this whole hand thing where I would go to the bathroom and then he would go to the bathroom and then I would let him in the girls' bathroom, watch the girls' bathroom so he could, go piss in peace, right? And then we could go back to class because like it got to the point where like he was terrified of going into the boys' room.
Yeah.
Between classes, because that would be where he would get harassed and things like that. Like just, talking to a lot of guys and how like, that was the age where I really started to see like emotional stunting or emotional oppression happening. And that's also the age where like, boys and girls start realizing like, oh, hey, like you're a guy and you're a girl, right? And that kind of distinction from the boys towards the girls and also towards other boys, I was just like, this just all seems so stifling. Like men just felt, especially like in the deep South.
Yes.
Because that was where I was, right? In Tennessee, right? Like I was just like, this just feels really, really oppressive. Like if being a boy to me at that age, like if I wanted to be a boy, like it felt more of a cage.
Yeah.
It
is more of a cage because also on teams, if it's a boys' team and a boy is not performing well, the coach might say, "What's the matter? You're on your period. You're a girl."
Right.
But they won't say that to a girl. You did really well. What's the matter? Your boy? No, never.
Right.
There's the casting opprobrium of the lesser sex. Women are considered the lesser sex, and so that looking like one is an insult. Males are considered the preferable sex, so looking like them is prestigious.
Right. That stuff is really early Europe to absorb that stuff. I remember in like playgroup, so I'm like 4 years old, and we were playing with these toys, and they turned out later they were Star Wars toys, right? And at the time, I was playing with this one toy I thought was great. The next day, I learned that was Princess Leia, and I was like, ugh, I don't want to play with that. Like, how the fuck did I like absorb any of that?
Observation is adult,
totally
right?
Between 1.5 and 3 years old, where they've tested this, children know whether they're a male or female and immediately start identifying with the expectations and ideas associated with the sex with which they identify. So that's between 1.5 and 3.
And I think to a certain degree, maybe I spent like the first 5 years in Japan, right? I think maybe part of like the reason that like I had like a little less of the extreme dichotomy in terms of gender was that like I really like kabuki theater. And like that was kind of like to a certain degree, like now looking back, I think that was kind of like to a certain degree my grandma's way of kind of like soft selling femininity to me when I was identifying as a boy, right? Is like she was like, your favorite kabuki actor, isn't he so beautiful in a kimono? Right. And I was like, oh yeah, like he fucking rocks that shit. You're damn right, grandma.
Yeah.
Like he's prettier than most girls. It's like, yeah, he really is. He does makeup so oh yeah, that makeup is fucking awesome. So I think that was like kind of her way of like selling me the that like it's okay to be feminine too. It really is, because I think she was kind of a little bit bothered by the fact that like I was so boyish in my appearance, but she never really she never really let it on. I think like now looking back, that was kind of her low key way like selling me femininity through like a guy in drag.
Yeah, that's cute.
Basically.
Yeah, and it's when I think back to that toy situation, I think about that if I had been at my house playing, it would have been fine. But because it's playgroup and there's a whole bunch of other boys that I'm playing with, it would have been like, yeah, no one wants to. I remember there was a segregation. It's like when you go out to play, the girls are going to do one lot of play, and the boys are doing a whole bunch of other kind of
That's
stuff.
right.
And it's like it's incredible to my mind now when I think back, like right back then is when all this stuff is programmed.
It is.
Yeah.
Totally. That's
Even
why.
you know my in my background, my family, they're all sort of very equal. You know, there's no sort of like harsh gender roles or divide or anything like that. But I knew it at that age. I knew something. That's weird.
Oh yeah.
Yeah, of course. And you know, in Sweden and all the Scandinavian countries and the Netherlands, they don't even use male, female pronouns for little kids because they want people to identify as people. And they really make a point of encouraging girls to play with trucks and boys to also play with dolls and to make a gender neutral environment for children. However, they'll notice what's going on outside as well. But those societies are much, much more aware of gender issues and gender equality than the United States is. We have a whole sector of the country, you know, the South and parts of the Midwest that are medieval in their awareness. So it's
a lot more traditional environment in those places, definitely. Yeah.
Yeah, and the traditions that they uphold are really segregated in terms of gender, race, class, and everything else.
I think having lived in the South, I think racism can be somewhat more overt there, but I don't think it's any less in places like, growing up north and, living in California now, right? Like I've actually probably had people tell me to speak English here in California more than I have in the South. Like if I'm speaking Japanese with my mom, right, in public, I've had a lot more people in California be like, speak fucking English. I'm like, I fucking can't, fuck you. Yeah.
It brings up for me the question that I have, which is, where do you want it? What kind of issues would you like to address? And from what viewpoint would you want to address them in the program?
One of the things that I think would be interesting would be like, also because a lot of people don't understand a lot of mental health conditions, right? They get these diagnoses, they have no idea what it is. They have, and one of the ways I think that we can kind of like also do like an educational component is like, maybe discuss like various diagnoses and talk about like how environmental factors, social factors, political factors, that pre-exist in those diagnoses, that they're not
That's
free
a wonderful idea.
From those, because like, one of like borderline, for example, because at my facility, like that, I got all the borderline kids, right? And there is so much fear and stigma and misinformation, and also like gender, diagnosis, right? Borderline is an extremely gendered diagnosis.
Yeah.
Because, I remember like I was talking to a therapist once on a plane, and he ended up doing anger management for domestic violence offenders, right? That was his, he did groups for court-ordered groups for, domestic violence. And he was just like, like, it's so funny that like none of these guys were diagnosed as borderline because they fit the DSM, yeah. But they don't get diagnosed as borderline. It's like, I don't understand,
Yeah. It's fascinating because I came across a book years ago called like I Hate You, Don't Leave Me, which was about borderline, because I had been in a very volatile relationship, one that I hadn't sort of, the dynamic I had never experienced before. And after the fact, discovering that book, it was like, well, this is everything that happened in that relationship. It sort of plays out. And then it became sort of a way of telling myself a story about the relationship that actually neglected all the sort of environmental factors that might have led this particular person to have dealt with the world in that particular way. But the book and the label was very much like, this is how a person is. It didn't include any sort of social environmental factors at all.
Right.
It was just purely like, this person has a problem. And
right.
And on reflection, when I think about the stories I heard or the history of things that she'd been through, it like, oh yeah, on reflection it will make sense. But at the time, it's all just chaos.
That's right, because they don't look at how you get there. And the way you get over how you got there is to go back. Like Hansel and Gretel, go back and see how you come home.
Yeah, the breadcrumbs, right?
That's right.
You follow the breadcrumbs. I mean, it's, border. Oh, go ahead.
No, just to sort of finish it off is just like going back to that over subscription to females getting cast this thing. It's like, well, no shit, like they're all being labeled with this thing because it's like they're, in theory, for the system, they're acting dysfunctional, but it's like, no, they're sort of acting out against things that are pushing against them.
Right.
And it's like if you have a sort of patriarchal system, it makes sense that suddenly you're going to diagnose all these women who aren't fitting into the boxes you want them to fit into.
Yeah.
Right. It was hysteria of prior years now.
Yes,
because
now
like
it's
the
borderline.
Borderline,
right.
Is kind of almost just like, now it's gotten to the point where like it's almost kind of like a throwaway term for like your crazy ex-girlfriend.
Right.
She's borderline, that gets tossed out so casually these days, and it kind of, really irks me because I'm like, that's a very specific thing you're talking about there. Right.
And that will be a really useful program of the kind that you said you wanted to see, talking about different diagnoses, where they come from, why they are the way they are, to whom do they apply, and who gets away with their non-application.
Right. And also just like, how it's grossly often misunderstood.
Yes.
Right. Like the common misconceptions. Right. And also just like, one of the things about diagnosis too is like we have to understand there's a lot of biases that the person doing the diagnosis
has. Absolutely.
Right. And also just like it's not necessarily like a permanent fixed condition that you are stuck with for the rest of your life. That, same with like,
anything.
It's a huge reason why I kind of, don't like the brain disease model of compulsive drug use, right? It's one of the clumsy ways of trying to remove stigma.
That's right, but also trying to pigeonhole that population and not look at the social ideology.
Right.
Why, why have they, conquered addiction by 75% in Portugal? Well, they made it legal. They give everybody counseling. Hey, that helps.
Right.
It's a socialist communist society. That helps.
Right. Well, and calling it a brain disease traps people into thinking it's a permanent condition.
And a medical condition rather than a psychopolitical condition.
Right. For some people, it could be. It's just that we shouldn't be applying that to everybody without doing due diligence, right?
And that is an agenda-driven pigeonholing of human beings,
right? And that is a agenda-driven pigeonholing that we see in mental health in general. But it's a biochemical, individualized, internal, strictly internal, process.
That's right. And the fact that not suddenly, but as the United States empire declines, addiction goes up. Well, why that? What a coincidence,
Right. Yeah. Because I've one of the things that's been like, lately irking me is dope sick. I don't know if you've heard of it.
Yep.
Have you heard of it? Okay. And it's one of those things where I really should like go back and like, reread the book with like a little bit more rigor instead of rage reading. But and it's one of those things where like and I guess what I really don't like out of the book is what people take away from it. That's really wrong, in my opinion, right?
Mhm.
So it's just kind of like, instead of like the really scary corner street dealer, right? It's now your doctors and pharmaceutical companies. And while they have a huge role to play,
They do.
obviously, but the huge factor is like a lot of these painkiller related, right? So people that are going from pharmaceutical painkiller use to
Mhm.
street drugs,
To heroin,
right?
yeah.
Yeah. A huge component of that is the fact that we don't have disability, that we force people to work in pain. That, we basically force an entire workforce into chronic injury,
Mhm.
right?
That's right.
And then once you're a chronic pain patient, pain
Whoa.
medication becomes incredibly hard to access, incredibly cumbersome to access. Like for short-term outpatient processes, they give them out like candy. But once
Absolutely.
you are a chronic pain patient, you are fucking penalized to the gills to access medication.
Because that's where they exercise control. Just don't prescribe opioids, even when people do have chronic pain because of chronic conditions. And so they go to the letter of this law without looking at the people's pain to whom they're prescribing.
Right. Like it was kind of, recently, I think, I can't remember which organization it was, but they were talking about like, reducing opioid, like the prescription for opioid prescriptions for cancer and terminal patients.
Ouch.
Terminal patients went down this year, and they were seeing this as a positive. And I'm like, motherfucker, you're going to like take pain medication out of a terminal patient and call that progress?
Yeah, that's just numerical progress without regard to the human beings involved.
But those are kind of like the things that fuel these conversations around prescriptions, right? And that's kind of why I hate the book so much, is because, again, the solution is like, oh, doctors shouldn't be prescribing these things. And it's like, no, that's a blanket reductionism. We need to look at why people need them,
right?
Which is injuries that they have to work through.
Right. And also why they need them and who does become addicted.
Right. Absolutely.
People get help without that and so on. That's all fudged.
Yeah.
No.
Yeah.
The whole idea, right, is to have this conversation so more people in your industries are having this conversation.
Yes.
And then that ultimately leads to some sort of change. And I think that's also something we should talk about with some guests as well. Like, what are the best mechanisms for change in the systems that everyone is operating in, right? Because it's one thing to talk about it, it's another thing to do it. And I know from previous podcasts or the reading group when Max has previously expressed that as a real tension that he's seen, is that like there's the talking about it and then there's the doing it. And how do you enact all the things that, could fix various problems, either in your industry or sort of just a broader sort of political sense.
Right.
And so, I think there's a whole discussion or many discussions to be had with various different people about what change looks like and how you do it.
Okay, that sounds great. Thank you, Liam, for being the coordinator of all of this. And thank you, Ikoi. This is great. Okay, looking forward. Bye-bye, everybody.
By the way, listeners, if you have enjoyed anything you've heard Harriet say in this program, you will definitely enjoy Capitalism Hits Home, which is a solo program that Harriet does through Democracy at Work, which is a worker-owned cooperative that produces other great programs such as Economic Update with Richard Wolff and the Anti-Capitalist Chronicles with David Harvey. I can't recommend enough that everyone also listen to Capitalism Hits Home if you enjoy It's Not Just in Your Head.
Capitalism Hits Home is a sort of broader overhead view. It explores the way that capitalism shapes our personal lives, our psyches, our relationships, our families, and it looks particularly at the sea change in American personal life as all Americans, but the top 10 or 20% of Americans, have our security and our chance for a future become as precarious as it always was for minorities and families headed by women. It's not just in your head, and Capitalism Hits Home are definitely complementary.
And if listeners would like to check out Capitalism Hits Home, Harriet, where should they go to find it?
Either on YouTube or Democracy at Work or on my own website, harrietfraud.com.